started this morning. We still have a few more of our elected representatives coming this morning, but we want to get started. My name is Maura Collinsgru. I'm the Healthcare Program Director at New Jersey Citizen Action. Thank you for coming out to join us on what is the 53rd anniversary of Medicare, Medicaid. I can't help but think just 3 years ago, New Jersey Citizen Action and our NJ for Healthcare coalition partners were across the hall in the chamber accepting a resolution on the 50th anniversary of Medicare, Medicaid. And that resolution spoke of all of the achievements and the progress that we had made here in New Jersey under those programs. There was a lot to celebrate. More than 500,000 people had enrolled in Medicaid because of the ACA's Medicaid expansion. Medicare had been strengthened, costs were brought down for seniors, preventative programs were encouraged, and value outcomes were improved. In New Jersey, these two programs alone cover nearly 3 million New Jersey residents. It encompasses seniors, the disabled, children, and low-income working families. And even as we mark the success of these programs that have become pillars of our healthcare system, we are also today sounding the alarm, because despite the repeated outcries of consumers, healthcare advocates, healthcare stakeholders, doctors, nurses, hospitals, patient advocacy groups, President Trump and the Republicans in Congress have launched an unrelenting attack on our healthcare to roll back funding, to cut benefits, and undermine the very health insurance marketplaces newly established under the ACA. Their unrelenting efforts to repeal the ACA and a tax plan now that did away with an individual mandate and made huge cuts in taxes for the wealthy and corporations now threaten access to health care for millions of Americans. What's at stake for New Jersey is billions of federal dollars and the health of millions of our residents. These are real people's lives. This is not, quote unquote, and should not be, a political battle. The millions of people whose lives depend on these programs deserve more. And I cannot tell you how proud we are here in New Jersey to welcome Adi Barkan, who is part of a national effort. Adi himself is spending his life and sharing his experience as to how pivotal these programs have been to the very care he never suspected he would need in his life. Adi is here from across the country. He is doing a tour, and we invited him here to exemplify the fact that these are real people's lives. And so I want to introduce to you Adi Barkan. Adi?